As you know, last night the first 3,900 doses of the Pfizer COVID-19 vaccine arrived at the Calgary International Airport, and I was excited to be there in person to see that happy day finally come. They have been transported to distribution centres, unfrozen, and the first inoculations have already begun. I understand that the first to receive it, just received the vaccine moments ago, was respiratory therapist Sarah Kahie at Edmonton's University of Alberta Hospital, and that intensive care nurse Tanya Harvey at the Foothills Medical Centre in Calgary is also receiving the vaccine as we speak. We expect to receive and begin administering another 25,300 doses of the Pfizer vaccine within the next week, and we are also looking forward to receiving our first tranche of the Moderna vaccines within a week or so. This is all wonderfully good news. Hope is here, and the end of this terrible time is finally within sight. Last week, I announced strong province-wide measures that we believe will save lives, bend down the curve, and protect our healthcare system. But our data tells us that some areas of the province continue to experience very high rates of transmission. So today, we are announcing a new outreach campaign to help Albertans living in such highly affected communities. Statistical analysis conducted by Alberta Health and the Emergency Management Agency have identified 11 communities in particular with the highest rates of COVID transmission in the province, 9 of which are in Edmonton and 2 of which are in Calgary. These areas require an additional layer of public health support over and above the measures put in place province-wide. And that's why today's announcement that's what it's all about. Albertans in these particular communities are at higher risk of COVID-19 due to absolutely no fault of the residents there. The residents of these communities often have public-facing jobs which may make them more susceptible to community transmission. Now let me pause to say how much I believe all Albertans appreciate those folks who've continued to work day in and day out providing essential services in front-line jobs, whether it's as care aides in hospitals or nursing homes, stocking grocery store shelves, or driving long-haul trucks, and so much more. We all depend on those working hard in these and other public-facing roles who often take greater health risks in order to do so, in order to serve our broader society and also take care of their families. And we must be there to support them. These heaviest hit neighborhoods tend to be lower income areas where people naturally live in higher density housing arrangements, sometimes with multi-generational families that can make it very difficult for family members to self-isolate effectively if needed. And it may also, in some cases, with elderly relatives at home, make seniors more vulnerable potentially to infection. Many of these families also have English language barriers, which in some cases may make it more difficult for them to obtain current and accurate health information and to access the social supports that are available to them. With an understanding of these challenges, we are establishing COVID care teams with our municipal and local community partners in Edmonton and Calgary in order to provide on-the-ground outreach and very practical support. These teams will go right into these neighborhoods in a safe, coordinated, and community-minded way to ensure that residents have the understanding, the tools, and the support they need to break the chain of transmission in their area. This is about having empathy and compassion for the very real barriers that many of those folks face and providing what they need to slow the spread in our 2 largest cities. Some of the things the COVID care teams will focus on include providing materials and clarification on the public health orders in the language that residents can best understand. Alberta's government will be offering care packages with masks, hand sanitizer, and relevant information delivered by those community care teams. We'll be ensuring that folks are aware on the ground of social supports, like, for example, the Canada Recovery Sickness Benefit will help individuals who may be sick to apply for and access this and get access to this and other income support programs. And this may be with families who have significant English language barriers, who perhaps don't have computers at home to do online applications, or may need help navigating through the bureaucratic process to access programs like that, which will help them, if necessary, stay home. A critical part of this community care initiative will be a massive expansion of free self-isolation housing support. Now, back in the spring, Dr. Hinshaw and her public health team concluded that most of the viral transmission that affected the meatpacking plant workers during those outbreaks was likely the result of transmission outside the workplace. That is to say, in similar neighborhoods with high-density households, where it was effectively impossible for people to completely self-isolate in many cases. In response, we began then offering select individuals who could not self-isolate to access 14 days in self-isolation at hotels at taxpayer expense. But since doing so in the spring, only a small number of Albertans, a few dozen, have taken us up on the offer. We believe that most people in high-density housing just are not aware of this very helpful public health support. And so I've directed that we massively expand the self-isolation support, particularly for people in these hardest-hit communities, and that we offer strong incentives for people to participate. As a result, Alberta now has 16 self-isolation hotels ready for those who need them. There are 6 in Calgary and 9 in Edmonton, with 1 up in Peace River. Currently, the maximum capacity in Calgary for the self-isolation hotel rooms is 791, and it's over 1,300 in Edmonton. We're procuring additional hotel spaces in the 2 big cities, as well as Fort McMurray and Red Deer. If there is sufficient demand, we'll expand the program even further. These hotel accommodations will provide culturally appropriate meals. We've worked with the providers, the contractors, to accommodate dietary and religious restrictions, but are also working with community organizations for meal drop-offs. The cost for both the hotel room and meal support averages to about $160 per person per day. Now, obviously, people taking time away from work and family are incurring costs to do so and giving up income. And as lower income families, these costs may be insurmountable. That's why I am also announcing today that as part of the community care campaign, individuals will be eligible for a temporary emergency payment of $625 once they've completed their self-isolation at one of the designated isolation hotels. This is the same payment that we make available to Albertans who evacuate from natural emergencies like fires and floods. So my view is that vulnerable people affected by this public health emergency who do the right thing by self-isolating need similar support to be safe. So the message is clear. If you've been asked by Alberta Health to self-isolate due to COVID-19, or even if you haven't been asked and you know that you've been a close contact or you're symptomatic, but you cannot safely self-isolate at home, we are here with real help. Free accommodation, food, transportation, and financial support is available for you. Minister Allard, who has helped to oversee the coordination of this as minister responsible for the Emergency Management Agency, will provide additional details on the criteria to qualify and the costs of this critical support. We are also working to ensure awareness of local testing centres in the most affected communities and access to them through transportation services, and will be providing information to encourage the use of safe vaccines, as community groups have reported to us that there are some widespread misconceptions about the safety of vaccination in some communities. Alberta's government is also launching a renewed public awareness campaign in 10 different languages across conventional and ethnocultural media, radio, television, and print, advertising, as well as various social media channels and web platforms, to ensure that people have access to this information in the language that they can understand best. The COVID care team approach follows the advice of the World Health Organization, which has said that one of the most effective strategies to control the virus is through strong, local, on-the-ground collaboration in communities that may be the most vulnerable. These on-the-ground groups and organizations we're talking here about ethnocultural groups, local neighborhood organizations, long-standing charities, settlement organizations that help newcomers, friendship centers in the Indigenous communities, for example, and faith-based organizations. These organizations have long-standing relationships with their community members, as well as knowledge about what works and what's needed on a more granular and personal level. That, combined with the support of Alberta's government, can provide information and practical help to Albertans in a way that they are most comfortable with, which helps us to ensure that we're reaching out in a respectful and sensitive manner.